Now, patients in England will be able to get treatment for common conditions like sore throats and shingles and infected insect bites at a pharmacy near them from today.
The scheme is part of the government's plan to free up 10 million GP appointments a year, but with the NHS already so financially stretched, will the new scheme relieve current pressures? We're joined by the Public Health Minister, Andrea Leadsom. Dame Andrea Leadsom.
Yes, morning.
A very good morning to you. Right, we're going to get to pharmacies in just a moment, but I'm sure you have seen this report from experts assembled by the British Medical Journal. The NHS is in such a dire strait that the next government should declare it a national emergency. We need treatment for the NHS itself. This is a dire headline for you. Morning.
Well, good morning. Yeah, I mean, I'm really sorry to hear that. That is not what I see as Health Minister in the department. There's so much work going on with, for example, our long-term workforce plan, backed by £2.5 billion, the first ever in the NHS to increase numbers of staff, things like the 160 community diagnostic centres that are really going to speed up diagnosis of different conditions and illnesses for patients. Our family hubs and Start for Life programme that I lead on, which is rolling out much better support for families with new babies across England to provide them with the help they need to give their baby the best start for life.
You talk about the long-term workforce plan. I mean, Rishi Sunak, in his interview with our colleagues on This Morning yesterday, admitted that is a long-term, that is not for now, that is a long-term plan. The problem with this report is... Sorry, that's exactly what he said yesterday, that this was a long-term plan. We're talking about the NHS being in such a dire strait now that it should be declared a national emergency. Record numbers of patients are being denied timely cancer treatment. Since 2020, more than 200,000 people in England have not received potentially life-saving surgery, chemotherapy or radiotherapy within the NHS's 62-day waiting time. That's shocking. The oncologist who has made the statement says it's the deepest cancer crisis of her 30-year career. I'm terrified about the thought of anyone with cancer going for treatment within our NHS, our crown jewel.
Well, you're absolutely right to highlight that since the COVID pandemic, there has needed to be a huge ramp up in the work to ease waiting times. The Prime Minister's made it one of his absolutely top priorities to cut NHS waiting times. The long-term workforce plan isn't for the long term. It is already, we're seeing more new GPs entering training today than we've ever seen. And to get more nurses into the workforce, we've already increased the number of nurses by 50,000. So actually, we are taking very urgent steps. And I'm delighted to say that we made a manifesto commitment to increasing the number of GP appointments that are available by 50 million a year. And we've already met that target. So GPs are doing a fantastic job.
Within 2 weeks. 1 in 6 can't see a GP within 2 weeks.
Well, the numbers are improving significantly so that many patients are now able to see their GP on the same day that they seek the appointment, but almost all patients within 2 weeks. But of course, going to what we're announcing today, the whole point about Pharmacy First is because the huge demands on GPs, more demand than ever before.
Can we come to pharmacies in a moment? We just want to finish on this front page of The Guardian. Here's 2 more figures for you to consider. I'm sure you know them. 53% of colon cancer patients are having to wait beyond the 62 days to get any kind of treatment, and 41% of those with lung cancer are having to wait longer than 2 months. These are galloping cancers. Every 4 weeks that goes by without treatment, the risk of dying from the cancer goes up by 10% every 4 weeks. Now, you talk about taking steps, but when are we going to see results?
So, as I say, actually recovering NHS waiting lists and NHS waiting times is one of the Prime Minister's very top priorities. One of the challenges we've had, speaking frankly, has been with industrial action. We've seen well over, something like 1.3 million cancelled and rescheduled appointments, which is devastating. So there is a huge focus on trying to get junior doctors back to the table to negotiate, to stop the industrial action. In November, when we didn't have industrial action for a period of time, the NHS waiting list came down by 95,000, which is really good news. But we need to really focus on that to get those NHS waiting lists down. But as I say, there are so many measures in place, our primary care recovery plan, to ensure that we get many more people able to see their GP and their practice nurses and physiotherapists and so on.
OK, well, let's talk about your plans that you're announcing today to increase the powers of pharmacists and pharmacists to step in and do some of the work that GPs currently are not doing because they haven't got the time. Isn't that actually just shifting the pressure? You're shifting it from GP surgeries into high street pharmacies, which themselves are under pressure and we all know are understaffed, and more of them are closing.
So the really great news about today's announcement is that it is a bit of a revolution in patient access. So we've seen demand for GP appointments increasing and increasing. We've taken huge steps to address that, successful steps. As I say, 50 million more GP appointments a year. But actually, pharmacists, who number well over 10,000, have voted with their feet, and over 95% of all community pharmacists have signed up to delivering pharmacy first. And what that will mean for patients is that with 7 common conditions, you will be able to walk into your local community pharmacist, ask to speak to the pharmacist in a private consultation room, talk to them about things like a sore throat, earache, sinusitis, impetigo, an infected insect bite, urinary tract infections. But in addition to that, you can already get your blood pressure checked. That was introduced last year. And for women, they can seek oral contraception from the community pharmacy. So for pharmacists, it's brilliant news because they're now working towards the top of their training. It also provides the footfall because, of course, community pharmacists are retail, they're private businesses. And so they want to have more people coming through the door. But for patients, it's a huge win because it means
infections. You mentioned infections there. Does that mean that pharmacists, to me personally, this is a key question, I get a lot of chest infections. Will I be able to go to a pharmacist who will analyse the fact that I've got a chest infection, bacterial infection, and can he or she prescribe me antibiotics, amoxicillin, penicillin?
So pharmacists will be able to prescribe, certainly, all of the antivirals and the necessary antibiotics, but only for certain conditions. So you will be able to walk into a pharmacy and ask for a consultation, but the pharmacist may well say to you, you need to go to your GP, or in certain cases where they're doing blood pressure checks and have grave concerns, they might even send somebody direct to A&E. But GPs likewise will be able to say to you, with this condition that we've seen from your records you have frequently, we recommend that you go to a pharmacist and seek antibiotics from them. But of course, just to be clear, nobody has to go to their pharmacist. This is about improving patient access, improving the treatment of common conditions, thereby freeing up GPs, we think to the tune of about 10 million appointments a year, to be able to focus on the more complicated cases. So GPs and NHS 111 and even elective services will be able to refer to pharmacists. They will be able to see you very quickly, walking in from the street, and then they'll be able to advise you on what steps you should take, or indeed to treat you where they can.
OK. Dame Andrea Leadsom, we have to leave it there. Thank you very much indeed. Thanks.